Thank you all for joining us. We're thrilled to have a chance to talk with you today about our dual degree in social work and bioethics, about which we're thrilled. It's a wonderful program, and we have some wonderful speakers to talk to you about it. I should just say I'm a professor in the medical school in the School of Public Health and director of the Master's of Bioethics program, and we're delighted to have Richard Takashi Hara with us. Richard, do you want to introduce yourself?
Thanks, Bob. And yeah, it's a great pleasure to be here tonight to provide some information about this wonderful dual degree program that we're launching. I, will cede my time to our terrific slate of speakers to come, and just wanted to note that, in social work, the signature pedagogy is practicum learning, and I'm so excited for us to be partnering with SPS to be giving students an opportunity really to learn more about bioethics, but also to get a taste for practicing bioethics as part of their education. So let me turn things back to you now. Thanks.
We're delighted to have some terrific social workers who are working in bioethics, and I'm going to introduce them now and then have them each speak. So first is Catherine Spear, and I'm going to let her talk about the details of what she does. Then Melanie, then Richard Siegel, then Samantha, then Sophia, and then Michelle. So without further ado, I've asked each of them if they could talk about what they do, how it involves bioethics, what they like about it, and then we'll have time for more interactive comments and back and forth as well. So without further ado, Karen, sorry.
Thank you. My name is Karen Spear, and I have worked at Children's Hospital Los Angeles for 40 years. I have a dual role, so I work as a social worker for the families in the neonatal intensive care unit, and then I'm also part of the leadership team of the Center of Bioethics. And what I love about that is that it's a truly multidisciplinary team. It has a few physicians, a nurse, and a social worker. I always feel like I'm the one that made it multidisciplinary. And it really, when I heard about this dual degree program, I was just so excited because I just feel that it is such a blending together of two disciplines, and it's such a natural blend. And we are seeing more and more and more social workers who are now social work ethicists, and it is becoming a bigger and bigger field. So what do I do? I feel that as an ethicist, I use my social work skills at every level. And the main thing we do is we have a consult service 365 days a year where we're available to any staff or family that would like to request a consult. And so then the first thing we're doing is we're listening. We need to be able to form a therapeutic bond quickly and be able to know how to naturally draw out the information that's going to be important to be able to really focus and decide what those ethical issues, what the ethical questions are. And we speak with we speak with families, we speak with all the different members of the team, and so often a reason for an ethics consult within a hospital setting is moral distress. And who better to work within the framework of helping and supporting moral distress than a social work ethicist. And a lot of what we do within our consults, so we talk to all the different members of the team, we talk with the family, we often bring everybody together. So then we have sessions with the whole team. Sometimes it's just to get everybody together to communicate and help to open up that up between all the different specialties. But often we just hold debriefing sessions or supportive sessions where we really are blending, discussing what the ethical issues are and how we're going to help define them and be able to move forward within the moral distress that we're experiencing, and also support everybody to be able to move on. So I feel that it's every day I have to always tell people which hat because I'm doing, and when I walk up to a family or a team, but I feel that every moment that I'm working as an ethicist, I'm a social worker. And when I'm working in the NICU as a social worker, I'm always bringing in the ethics. So it really is something that I feel is a natural blend, and I do it every day, and I love it.
We are delighted to have Melanie with us. Melanie?
Oh, fantastic. Thank you. So I'm Melanie Pinkett Davis. I have the pleasure of serving as the Assistant Vice President of Clinical Services within Kennedy Krieger. Kennedy Krieger is a nonprofit academic medical center in Baltimore, Maryland. So we provide pediatric rehabilitation services, specialized inpatient hospitalizations related to recovery from spinal cord injuries, and a host of other needs. We also have non-public schools and a really robust research infrastructure, in addition to some comprehensive outpatient programming. So I've been in the organization for 26 years. I've been a licensed social worker for 23 years. And I've been the vice chair of our ethics committee for about 4 years now. I'm really excited to have the opportunity just to share more information regarding this like really seamless and intuitive integration that happens between my role as a bioethicist and as a social worker. And kind of the other hat for me is like the administrator one. So certainly from an ethics committee standpoint, I actively engage in ethics consultations several times a week. We are also able to review policies that are impacting our organization as a whole. And sometimes that relates to research or patient care. But whenever there's a question or we want to ensure that a change that's happening has been properly vetted, the ethics committee has an opportunity to contribute to some reflection, discussion, and recommendations. I also serve as the education subcommittee lead. So that creates an opportunity to provide professional development for a variety of clinical disciplines and other professionals across the organization. And that we find that that's an incredible way to also increase awareness of our ethics committee, and that it really helps individuals to feel more competent and have more confidence in their ability to navigate some of the ethical quandaries that come up in their day-to-day clinical work. When I think about this kind of what makes it unique about being both a social worker and a bioethics, I think about social work being so person-centered and kind of adept in problem solving, which is really a skill that's needed for bioethicists as well. As a clinical social worker, of course, we have that training and working with colleagues from a variety of clinical disciplines, and really having the ability to take on the perspectives and goals and understanding the roles of others, and being able to synthesize that information in a way that sort of really helps us to navigate some challenging situations in a manner that gives consideration to all parties involved, while remaining kind of laser focused on the goals or tasks at hand. I share Karen's passion as it relates to supporting healthcare professionals that are navigating moral distress, and really as they're seeking to build moral resilience. And so I'm really fortunate to have the opportunity to not only support professionals on an individual level and through our ethics consultation, but also from an administrative standpoint, I'm able to positively impact our workplace's ability to maintain a culture of wellness and to support especially early career providers. And so I think this opportunity that we're discussing today of the dual degree is a really unique and fantastic one, because there's really this really seamless integration between the two respective fields, and I'm looking forward to discussing it further. Thank you.
Great. Well, thank you so much, Melanie. Next, we have Richard Siegel. Richard, welcome and thank you.
Thank you so much for having me. It's wonderful to talk to everybody. I am a graduate of Columbia University School of Social Work, class of 1979. So that means I've been a social worker for 46 years or so. And I am now retired from being in the New York City Health and Hospitals, the public hospital system. While I was there, I was the director of social work at Metropolitan Hospital, which is in East Harlem, which is one of the poorest communities in the city. And I was one of the chairs of the ethics committee there. I was also one of the first non-physician I was the first non-physician co-chair of the system-wide H&H Ethics Council. I teach now at Silverman Social Work. I teach policy and social health policy. I agree with everything that both Karen and Melanie said. The social work and bioethics is such a wonderful mix together. I've jokingly said that social work was my job, my career, and is still my life's work. At this point, I've been a bioethics consultant and leader for the last 10 years, and I think see them so totally intertwined. Um, Ethical dilemmas come up when two core type principles intersect and conflict. And so the role and Karen said it very eloquently, the role of a social worker and the role of a bioethics is so similar. It's getting into meeting the individuals, giving them an opportunity to speak, giving them an opportunity to share their experiences, bringing the team together, sometimes working on mediation when there's conflict within the family. So it's a very powerful way of helping people and representing people. Ethical issues often also come up with those of the who are considered the least among us, people of color, the queer community, and people in disadvantaged communities. And so we often help both as social workers and as bioethicists amplify the voices of people so that they what they're feeling and how they're experiencing things um, is expressed and in a way that the whole team can hear it. And the wonderful thing about ethics is you come to a conclusion that really puts the best of everybody together. Um, Another core part of the team happens to be the chaplaincy and spirituality. So this is a wonderful degree. I am looking at the bioethicists on the panel. Bob is somebody that has been a mentor and I've looked up to for as long as I've been in bioethics and we're following his readings. David and Anne are also incredible leaders in the field of bioethics. So you have, and I know for sure that the Columbia social work staff are awesome. So you have just a wonderful group of people that are really going to help you learn and grow and be the best you can be as a social worker and the best you can be as a bioethicist. So thank you.
Thank you, Richard. That's great. Next, we have Sam Dyer. Sam, welcome.
Hello, thank you for having me. And I just want to say I'm actually honored to be included in this panel with so many incredibly credentialed and experienced social workers and bioethicists. So my name is Sam, Samantha formally, but I go by Sam. I currently work at Winship Cancer Institute of Emory University, and I am a BMT, so bone marrow transplant and hematology oncology social worker. And I primarily work as a social worker. I graduated from UGA in 2016 with my master's degree, was pretty immediately hired into a hospital system, working as an ICU and ortho neurotrauma social worker, ED, and NICU. And fell into ethics is the way I like to describe it. In those inpatient environments, you see a lot of ethical dilemmas that come up. And I started being involved in the ethics committee, started being involved in the ethics huddles the ethics committee held, started getting really interested in what bioethics was, because in my program, it was not something that was taught to me. And I think that's how a lot of us social workers get to bioethics, is we fall into it. We find it. We happen upon a case that piques our interest, and we discover this whole new world of conversation and advocacy and education. And I fell in love with it. I did an internship with my hospital in Gainesville, Georgia, a 6-month internship, sat on their ethics committee, and then moved to an emergency room, which I worked during COVID. And my director there, we built our ethics committee from the ground up, where I also served And I was like, man, if I could just be a social work bioethicist, like that would just be my dream job. And she said, well, get your master's in it. And being at a Catholic hospital, they wanted me to go to Loyola. And I remember interviewing for Columbia's, and they were like, well, why do you want to go to Columbia? And I've always been intrigued by the level of rigor that Columbia provides compared to other institutions, even Emory. Emory has a master's of bioethics degree here, and I was most impressed by Columbia's program. And I'm very glad I made the decision I did. So I joined the bioethics program in 2019. I've taken classes from David, Arthur, Dr. Klitzman. I work with Anne in her bioethics forum, and really loved getting to dig deep into these issues, but was super disappointed to see that there was only one of me in my cohort. I was the only social worker. And I was flabbergasted because social workers are so uniquely trained to do this work. And we don't even know it. And we enter these scenarios with a perspective or a baseline with a perspective of how can we help? And we also are taught to view the world with such duality that it really allows us to look at ethical dilemmas in a way that it's not about fixing the problem, but it's about finding the best way forward. Our interests are very different, I think, than others who may enter this arena. And but unfortunately, here in Georgia, ethicist positions are few and far between. So I've really had to kind of find a way to work this into my everyday work, so into my social work. So I developed an ethics huddle that I currently facilitate at Winship right now with just the social workers. I've actually got approval to take it clinic wide. And then also really tackle the space of outpatient ethics. So most of our ethics programs operate within the acute care inpatient units. But Liz, who was originally going to be on this, who works over at Sloan Kettering, and I have talked extensively about, well, outpatient ethics is like preventative ethics, right? It's helping us avoid ethical dilemmas once our patients get inpatient. And so really working to work with Emory's teams on trying to build a bridge between inpatient and outpatient ethics, trying to educate my team members on to think bigger than the patient in front of them, to think about issues that are outside of oncology, and to really challenge them to speak up when they see ethical issues, because it's not encouraged in the outpatient setting, which I was pretty distressed to find out when I started working at Emory. And so that's really the role I feel now is education. I advocate for ethics, and I try to improve how our systems are currently working. I hope to one day be able to lecture and to work clinically. But I consider David my mentor. I don't know if he likes that, but it's the way it is. And he's always told me, Sam, you are working in bioethics. And I think also expanding what that means for a social worker, right? Just you don't have to have the HEC certification. You get to work in bioethics in many different ways. And again, that comes back to the duality of social work. We can do two things can exist at the same time. We can do lots of things at the same time. So that's my experience. It's definitely a little different from others here on the panel, but it has been a wonderful experience. The curriculum is wonderful. And I would recommend it. I love the idea of this being in conjunction with social work. So when people step out of their programs, they know what bioethics is, and they know how to head into this very complicated system we currently live in, ready to do the work. And that's what I love. It helps people find it a little sooner, which I think is a very beautiful thing. But yeah, so that's me. And again, thank you for having me on the panel.
Thank you, Sam. And next we have Sophia Fantas. Sophia, thank you for joining us.
Hello, everybody. Thank you so much for having me. So my trajectory is also just a little bit different from what you've heard from others, because I actually found bioethics first before social work, surprisingly. So I'll walk you all through a little bit about where I'm at and how I got to where I'm at, just to help you think through some of your career aspirations or goals or what you can do with a degree in bioethics and social work. So I took my first bioethics class in undergrad and wound up changing my entire major because I fell in love with the class and majored in religion and bioethics. And what does one do with religion and bioethics? One decides to go into social work. So I went and got my master's of social work. And I'm so sorry, but I got it at NYU, Silver School of Social Work, which was a great experience. But I always felt like bioethics was a missing piece. And actually being there was no dual degree. And so I was in social work, but there were not a lot of opportunities to merge bioethics. And not a lot of the social workers there knew what I even meant by bioethics, or if I wanted to do my practicum at a hospital and learn about ethics, there weren't a lot of opportunities. So I saw that somebody's from Toronto. I am too. I got my undergrad at University of Toronto, and I actually decided after my master's to move back to Toronto and go to the University of Toronto for my doctorate and do a dual PhD in social work and bioethics, what they had just started at the Joint Center for Bioethics. So decided to merge it kind of very early on in my career of getting that joint PhD. And it was a phenomenal experience. What that meant was I got to have folks on my committee from both bioethics and the Joint Center for Bioethics, as well as social work faculty. I got to merge bioethical theories with social work theories, and I got to choose a project that really culminated in both. So my dissertation looked at gestational surrogacy experiences for gay men in Canada. And that was a purely qualitative research study. So after that, I really started to kind of get an interest not just in bioethics, but also clinical ethics. So it was at that time, and Carly, you'll appreciate this since you're from Toronto, but it was at that time that I connected with the ethics team at the Hospital for Sick Children and started even doing additional work there during my PhD. And somebody there was really interested in moral distress in nursing. And I was like, is anybody talking about moral distress in social work? And we started looking at research and we saw that there wasn't anything there. So aside from my dissertation work, I actually wrote a conceptual piece on what moral distress may look like for social workers and specifically healthcare social workers, because there was nothing done in that area. And after my PhD, I was really burnt out by academia. And so I decided actually to do a clinical ethics fellowship and was lucky enough to get into Baylor College of Medicine in Houston. So made the move down to Texas from Canada, and told my friends that I'd be back in 2 years. And here I am still in Texas. But went there and did clinical ethics at Houston Methodist Hospital for 2 years, where I sat on a heart and lung transplant board. I was on call. We were doing ethics consultations. And I just want to speak for a minute on what Sam said, because she said it so eloquently and so incredibly well, is that I didn't realize the unique perspective social work comes from. So what some of you may or may not know, and I haven't met all of you online, so I don't know which area you're from, but you can come, what I love about clinical ethics and bioethics is that you can come from any discipline and come into clinical ethics. There's not one track to become a clinical ethicist. And that can be so rich because you are brought onto this table. And at Houston Methodist, we had actually had a very large clinical ethics team. And I was at a table with philosophers and lawyers and MDs and all these incredibly talented intellectual folks with terminal degrees, but from all very different professional backgrounds and clinical backgrounds. And that created such incredible dialogue, critical dialogue about important and tough cases. But at the table, nobody was talking about social work ethics. Nobody was talking about, let's say, social determinants of health, health equity, potentially patient and families' prior negative experiences in healthcare that potentially created and triggered some of these ethical dilemmas. Nobody talked about end-of-life care and, gaps for certain populations. And I felt like I was at the table screaming and nobody else really understood what I was saying. And I think for that, not only did it help shape who I was as a social worker and ethicist, but I really hope, I don't know, but I believe that it shaped our conversations. And one of the conversations that happened actually, there was, and I'll give this story very briefly because it sits so deep in me, is we were on a heart and lung transplant board conversation. And I was a poor, little intern in the back and didn't want to say anything. They were having a conversation about somebody who had been previously incarcerated, but who was on parole and out and needed a transplant. And conversations started to go around why were they incarcerated? What happened? What were they doing? Instead of clinical considerations of whether or not this patient needed a heart transplant to survive. And they started equating their incarceration with what they did and their value as a person. And obviously, I'm not going to tell you, this is ethics, you're all going to have your gut reaction. But I spoke up as this social work fellow, as this clinical ethicist. And I said, what are we doing here? And I said, can we think about some of the reasons for incarceration? And can we talk about whether or not that should matter if somebody did their time? And it started a very hot debate within the transplant board where they actually had to pause it and we had to create a second meeting where then they took a vote on what happened. And so nobody else around the table was thinking that, or they were, and they were silent about it. So social work has a place at the table. Social workers can be leaders, especially in ethical conversations and ethical dialogue. And I learned that really early on as an ethicist. I got my Hep C because I passed the exam while I was still there and doing clinical ethics work because I wanted options. The other great thing about a dual degree and having both an ethics background and a social work background is, I'm sure what many of you are hopeful for is career trajectory and career aspirations and job opportunities. I was very fortunate enough that I got to apply to both at the end of my clinical ethics fellowship, clinical ethics positions and tenure track positions. And I got offered both. And I got to make a choice. And that's really hard and really rare. But when you have unique skills like that, when you have a dual degree, it just broadens your opportunities. And I chose the tenure track, if any of you are interested, because I was told it's easier to go from academia back into clinical ethics than go into clinical ethics and try and get back into academia. And it was my own kind of self thing. I said, I wanted to know if I can do the tenure track. I want to know if I can do this. And I will say that as of September 1st, I'm an associate professor with tenure, so I did it. You can check that off and move on with my life. No, but I still get engaged with clinical ethics. And the reason also that I chose academia is because while I was a clinical ethicist, I also started to do a project on moral distress among healthcare social workers and healthcare chaplains, because there wasn't a lot of scholarship on chaplains' experiences with moral distress. So I interviewed social workers and chaplains at Houston Methodist Hospital, published on that, and decided that I wanted to do more. I wanted to make a difference in social work education and chaplaincy education, because moral distress is often conflated with burnout, and all social workers here is burnout and compassion fatigue, but they don't understand the ethics of how moral distress might look and act and feel differently than that. So I decided to go to University of Texas at Arlington, where I still am, and I've done some big studies on moral distress and moral injury among healthcare social workers and chaplains that are published. And moving forward, we actually just found out we got the John Templeton Foundation grant to look at spiritual care interventions in the Veterans Health Administration. And my work is slowly moving towards looking at moral distress and moral injury among service users, especially around postpartum grief and birth trauma. So there's a lot of opportunities there where my social work values and social work career really inform ethics and my bioethical thinking. And I can't separate the two. I'm an interdisciplinary scholar. It has always worked for me, and I miss clinical ethics a lot, but that will always still kind of be an option and be there for me to get back into the hospital and to see it. But what I observed and witnessed and saw as a clinical ethicist informed my research and informed my scholarship and pushed me forward to make sure that we are doing evidence-informed stuff to shape interventions and to actually have an impact on the daily lived experiences of healthcare social workers and chaplains who are doing the work and who are there. So I'm just a big proponent of this dual degree. I wish it was there when I was a student, and it will broaden your opportunities and broaden your options so much and inform critical dialogue, inform that thinking, and really elevate your work so much. And if any of you have any questions, I'm always happy to talk to students.
Great. Well, thank you, Sophia. It's great. And congratulations on the grant and everything else and the tenure. Next, last but hardly least, is Michelle Ballin. Michelle, welcome.
Thank you so much. So it is an honor to be here. I'm a 50-year-old woman with blonde hair and pale skin today, but typically wearing more makeup, and I have a red and black dress on. So I start with my depiction for those of you who might have vision impairments, and the entire focus of my work has always been around disabilities. I was a student at Columbia's bioethics program. It is a phenomenal program. And I was a professor at Columbia in the School of Social Welfare. And this degree is the culmination of a lot of hard work. And for any of you who are looking to pursue it, you should be very proud to be among those who will be in this dual degree program, especially since it's been a decade in the making. So really, congratulations to Columbia for being now one of 6 dual degree programs in bioethics and social work in the country. So my work is a little different than everybody who's spoken, but where I really want to focus is around the work that I do with people with disabilities, because that's what drove my desire to create this dual degree program. And as a student who entered bioethics, it was because I work clinically with people with disabilities who are experiencing considerable inequities and disparities in their healthcare and their healthcare access. And so the focus of my work in bioethics has always explored the tensions between the medical model of disability, which really looks at cure and fixing people who are by the experts, versus engaging people with disabilities to help think as leaders of their own network and dismantling the environments and the systems that actually disable them. And these systems were, of course, created by non-disabled people. So I always start with the premise that individuals with disabilities should have equitable healthcare access and be in control of their own healthcare. And every aspect of my work has always been conducted alongside individuals with disabilities. So at the forefront of social work and bioethics is really the interdisciplinary nature of our work. And one of the areas where I get to exemplify bioethics and social work every day is at the Leadership Education and Neurodevelopmental Disabilities Center that I've created at Stony Brook University. And Columbia is one of our many partners. We have 125 affiliate sites. We have several universities. And at the forefront of this is changing the mindset of the way many of us were educated. So what we do is we elevate self-advocates with disabilities, family members, and we bring in individuals from over 10 healthcare professions, and we train thousands of people in how to work in an interdisciplinary fashion to create leadership for individuals with disabilities and how to change the mindset of working together to dismantle the systems that further disabled individuals as a whole. Some of the work that I do is exploring the ethical tensions in bioethics around things that we take for granted, such as working with individuals with autism who may flap their arms or bang their heads or do other stereotypy and other perseverative behaviors that actually might be regulating and comforting to them, but maybe doctors or parents or teachers want to minimize these behaviors. So what are the tensions and actions in those behaviors and the suggestions that we make? Things like, why have people with disabilities for so long been able to donate their organs, but have trouble having organ transplants at the same rates? Why are people with disabilities excluded from clinical trials and then denied the medications that they need for healthcare? Why do people with disabilities experience intimate partner violence at higher rates than other groups, and yet they're assessed and treated at lower rates in our New York emergency departments? They're the largest healthcare consumers, but we need to be at the forefront of these questions, both clinically and in a research manner, to ensure equitable access for this population.
And we owe a huge thanks to Michelle because, as she said, this dual program was her idea 10 years ago. So we're immensely grateful to you and for all the amazing work you've done since then. So thank you. So I thought I'd talk a little bit about some of the logistics and some other issues. So an advantage of our dual degree program is each of our programs, that is the School of Social Work and the Bioethics program, counts credits from the others. So students earn both degrees for substantially less time and tuition costs than if they pursued them separately. Next slide. And this is just a sample sort of time frame here, but year one, students are with the School of Social Work. They take one bioethics course. Year two, they're with bioethics, and year three, they go back to social work and again, just do one bioethics course then. Next slide. So the whole thing's in 3 years, can be an all online. And just to show you how this works out, so if you do them separately, it would be 36 credits of bioethics and 60 credits of social work for a total of 96. If you do them together, it's 30 credits of bioethics and 51 credits of social work, so it's 81. So it's almost 20%, 25% savings. Next slide. So what is bioethics? As you've heard, issues confronting the ethical, legal, social implications of advances in biotechnology, biomedicine, healthcare. These are increasingly rising, concerning people with disabilities, other vulnerable communities, as we've heard. Next slide. Obviously, as we've heard, bioethics sits at the intersection of a bunch of other fields: culture, economics, public policy, philosophy, history, religion, law, society, clinical services, etc. Next slide. There are bioethics issues, as we've been hearing every day in the newspaper: AI and cancer. We have one AI ethics course about to start another: future of babies, gene editing, etc. Next slide. Issues of when life begins. Next slide. Issues of designing babies. Next slide. Issues of relationships, as we've been hearing: communication, boundaries between providers and patients, social workers, but also other providers, physicians, allocating scarce resources. We've heard about organ transplant. Next slide. Research is a book I wrote, The Ethics Police, a struggle to make human research safe. Next slide. Issues about costs in healthcare: who should get vaccines, should we mandate vaccines, the role of money, how that can distort things, but we live in a capitalist society. Issues of when we cease to exist, definitions of brain death. Next slide. Obviously issues in healthcare policy, as we've heard. Next slide. Some bioethical principles. Next slide. We look at autonomy, respect for persons, beneficence, non-maleficence, justice. Next slide. I'm sort of rushing through these, but we'll be sending the slides out. In terms of the bioethics program, as an overview, next slide, it can be done all in person, it can be done all online. As a social work degree, it can be done all online. So you can do both degrees online, or you can do it ours in person, social work as well, or you can do a hybrid of a mix of some online, some in person. We have extensive curriculum and advising support, etc. Next slide. In the bioethics program, we have 5 core courses: philosophy of bioethics, law, clinical, global, and research ethics. Next slide. And then we have, you can focus if you want on clinical ethics, research ethics, global, regulatory, biotechnology, pharmaceutics and ethics, or policy, regulatory, and ethics. Next slide. We have many electives: AI and ethics, advanced mediation, clinical ethics consultation, mental health ethics, reproductive ethics, etc. Next slide. We also have a thesis, which we have a workshop to help students work on, where you work closely with an advisor to really develop some expertise in a particular area. Next slide. We have a very strong mentoring program. Next slide. So in terms of the application, you apply separately to the social work school and to us in bioethics. For bioethics, we have an online application, $150 non-refundable fee, transcripts from all post-secondary schools, 2 letters of recommendation. We also have a certificate in bioethics, which is 4 courses, and you don't need the letters for the certificate. We ask for a CV or resume, a statement of academic purpose discussing your purpose and interest in the programs, your goals. For the master's degree, we ask for official scores on GRE, MCAT, or LSATs if you don't already have a terminal degree. And you don't need that for the certificate. And we do a video essay, and we often have a short admissions interview. Next slide. For the social work requirement, there is again an online application, a $75 non-refundable fee, transcripts from all post-secondary schools, and for coursework outside the U.S., a official course-by-course evaluation, 2 letters of recommendation, resume or CV, essay responses, and if English is not your undergraduate degree wasn't taught in English, we ask for a TOEFL, etc. Next slide. So in terms of next steps, we have please feel free to stay in touch with us, and we have a few moments for questions. So I want to importantly thank all our speakers and thank you all for joining us.